Why do people snore?
It's a disruption in airflow. So that is, as you breathe in and out, if the airflow gets rough or turbulent. I think everyone has been on a plane to experience that rocky air flight. And that's essentially what goes on when you're snoring. That rocky airflow causes the tissues to vibrate, which makes the noise.
What tissues are vibrating?
The roof of the mouth, the back of the throat. The airflow can be turbulent because of nose problems. People have heard of maybe a crooked septum or a blockage in the nose, or allergies that can cause the airflow to get turbulent.
So a bad nose.
A bad nose.
Why does the nose, if you can't breathe through your nose, why does it make people snore?
It changes the way the air comes through. So patients often will start to mouth breathe as a result. When the mouth is open, the tongue and the palate cease to keep each other steady, and the tissues start to vibrate.
Is it worse if somebody's laying on their back versus if on their side?
You know, most patients will snore much worse on their back than they do on their side, though often people can snore on their side or stomach.
Upside down?
Upside down.
Anyway, there is.
Yeah.
What other, we've got a bad nose. What does the throat, have a typical appearance of really habitual snorers?
This is a nice part about it. Patients can do this at home. They can open up wide and look in the mirror and see what they see. If they can see that dangly little uvula in the back there, that thing that hangs down, then they have a pretty open airway, and that makes snoring less likely to happen. Some patients open their mouth wide, and all you see is the roof of the mouth, a big tongue, and it's very, very crowded back there. And a crowded mouth, a crowded airway, makes the airflow really strained to get through all those tissues down to the lungs.
What does being overweight do to snoring?
Makes it more likely to happen.
Why?
On either side of the airway up here are two collections of fat. And as you put on weight, generally, these grow, which actually causes the airway to get smaller and changes, again, the way the air flows through there.